Welcome, everyone. Thank you for coming. My name is Kayla Mosine. I'm the Communications Coordinator here at Circle Egg Donation. This is our first webinar for prospective egg donors. Okay, before we get started, just going to do a bit of housekeeping. You can listen in by either using your computer speaker or you can dial in. Okay, on today's webinar, we have Gina-Marie Mariano Madow. She is an attorney and she's a 4-time egg donor herself, so she's got a wonderful perspective on the experience. And we also have Dr. Vicken Sahakian. He's the medical director at Pacific Fertility Center in Los Angeles, and he'll be reviewing the medical process and the IVF cycle. On today's webinar, we'll be reviewing the process of egg donation, the requirements for applicants, the process of applying, the different types of donations available, legal aspects, the medical aspects, and then finally the compensation packages for egg donors. Okay, right now I'm going to hand it over to Gina-Marie.
Hi everyone. Like Kayla said, my name is Gina-Marie. I'm one of the attorneys at Circle Egg Donation, and I'm also a 4-time egg donor. I'm really excited to be here with all of you tonight to tell you more about egg donation. So the first thing is, what is egg donation? Egg donation is the process by which a woman produces several eggs for the purpose of assisted reproduction. Naturally, a woman only produces 1 egg per month, but with egg donation, a woman will produce several mature eggs using medication. What are the basic requirements to be an egg donor? You should be between the ages of 20 to 29 years old. You should have a BMI lower than 28, no more than 1 occurrence of the same cancer in your family, no serious heart disease or heart attack, no psychiatric hospitalizations. You must be a U.S. citizen, minimum of a high school degree, college degree is preferred, applicants of all ethnicities and racial backgrounds are encouraged, and you must most importantly be comfortable with giving yourself daily injections. The next slide we have up here is the Circle Egg Donation website. So the first step in becoming a donor is go to circleeggdonation.com, click on the link to become an egg donor, and that will bring you to the application. The application process begins with a comprehensive questionnaire asking you about your biographical details, education, medical history, physical attributes, personal characteristics, menstrual cycle, motivations, family support, and matching preferences. This will help us identify a match for your intended parents. The application is roughly 100 questions and takes most donors about 25 minutes to complete. You're able to save your progress if you're not able to finish the application in one setting. What are the next steps? After the initial review of your application, Circle Egg Donation's manager, Eleanor Sidman, will reach out to you with the next steps, including screening and matching. Eleanor will also provide some important information about the process and what you should expect. Now, the matching and types of donations. There are 3 different types of donations: known, identified, and anonymous. As a Circle Egg donor, you're able to choose which type of donation you want to pursue. Known donation is where the intended parents and donor exchange contact information and can have contact with each other by either phone, email, or in person. Identified donation is where the donors and intended parents exchange at least some demographic information, but your identities are still kept confidential. You could still have contact by either phone, Skype, in person, or email, but again, your identity is kept confidential. Anonymous donation involves no contact between the donors and the intended parents. The egg donor contract will list your first name only, and all other information is kept confidential. Oops, sorry about that. In my personal experience, I did 4 egg donations. 1 donation was completely known, 1 donation was identified, and 2 donations were anonymous. In my personal experience, I prefer a known or an identified match. The reason for that is because it really made me feel good about the intended parents that I was donating to. I felt that once I got to know them and a little bit more about them, I was even more confident in my decision to be a donor because I could see what wonderful parents they were going to be. My anonymous donations were still special in their own way, but they were very different because I didn't have contact with the intended parents, and I don't know the full results from the donation. The known and identified matches, I've been fortunate enough to maintain contact still to this day with the intended parents, and I've been lucky enough to even get pictures of their children. The other important aspect of known donation is that I'm able to update the intended parents with changes to my medical history. Being an egg donor is a lifetime commitment. It's a commitment to helping bring a child into the world, and Circle Egg Donation believes that being a known donor is the best way to help facilitate that bond with the intended parents and their child. Now, what is the screening process? Donors will travel with a companion to the intended parent's IVF clinic for the medical screening. At the medical screening, you'll complete a physical exam, including blood, genetic testing, psychological testing, to determine your suitability as an egg donor. Part of the screening is a psychological assessment. All donors are required to take the MMPI. The MMPI is a standardized test designed to detect behavioral abnormalities. If the egg donor passes the medical screening, you then move on to the next stage of completing your legal contract. With the legal contract, you will have, the donor and intended parents will have a legal contract in place, which will outline your arrangements and the fact that the donor is relinquishing all rights to the eggs and any resultant child. If you don't have an attorney that you want to work with, we can recommend an attorney who specializes in assisted reproduction. You will have your own attorney, and the intended parents will also have their own attorney to represent their best interests. Other important things that are included in your legal contract are your fee, the estimated timeline for your cycle, the IVF clinic and physician to be used, the reimbursement for your travel expenses, and health insurance coverage. And next is travel. There will be 2 occasions where you'll need to travel. One is for the medical screening, and the other is for the egg retrieval. For both trips, the donor will be able to travel with a companion of your choosing, and all travel expenses are going to be paid by the intended parent. For the medical screening, you can expect to be away for 1, maybe 2 days, and for the egg retrieval, you can expect to be away for anywhere from 4 to 9 days. How long you'll be away for the retrieval will depend on how your body is responding to the medication. The IVF physician will let you know 36 hours prior to your egg retrieval, and you'll be able to go home roughly 24 hours thereafter. And now the next part is I'm going to turn everything over to Dr. Sahakian so he can give you an overview of the medical aspects and the IVF cycle. Dr. Sahakian?
I'm here.
Hi, welcome. We're going to get started on your segment now, the medical aspects of egg donation.
Wonderful.
It's over now.
Let me wait till I get my So how many individuals are present?
We have 2 attendees with us today. 3, excuse me, 3.
Okay.
Sorry, everyone. Just be patient. We're just switching over.
No problem. Do I have control?
Not yet. We're handing it over in a minute. Okay, go ahead, Dr. Sahakian. You have control now.
Great. Okay, so welcome the individuals that are present. So I presume that you guys are thinking of becoming egg donors and trying to find out more about the process. I'm going to give you a brief but pretty comprehensive overview of the process of egg donation. Let me see if the slide moves. Didn't move yet. Here we go. Some of this already has been probably presented to you, but basically In order to become a donor, you have to fill a questionnaire, and then you have to wait for a match. Once you are matched with a prospective parent, then you go to the screening, which includes the psychological and genetic screening, and then you get to the point where you have to meet your IVF doctor who's going to do the procedure. The first visit is an in-person visit usually with your doctor, where he or she will ask you a bunch of questions about your history, your medical history, and then you will undergo some testing, which includes blood tests. You give a urine for drug testing, and then you will undergo an ultrasound examination. The whole visit will probably take under an hour. There's no invasive procedure during the testing process, and it's just blood tests, a urine sample, and a pelvic exam like you're going to your gynecologist. And then once the tests are done, you're going to wait for the results, which usually take about 2 weeks. And then as soon as all the legal paperwork is completed, you will proceed with treatment, which I will explain in a second. So let me go to the next slide here. I don't know why it's not moving. Here we go. Okay, there are 2 parts to the egg donation process. As complicated as this whole thing might sound to you, it's really very simple. Divided in your mind into 2 parts. The first part are drugs you have to take, hormones you have to take to produce eggs. And the second part of the process is a procedure you have to undergo to get those eggs out. So once you see your doctor and you undergo the testing, then you're basically waiting for the treatment to start. The treatment typically starts with your period. You will call as soon as you start your period, and you will be placed on medications to stimulate the production of eggs. Before I discuss that, I want to go over quickly the reproductive physiology in women, because that will make you understand.
Can you speak up a bit?
Oh, you can't hear me?
Yeah, just a little bit more would be wonderful.
Okay, no problem.
Great, thank you.
That's good. So the reproductive process is very important to understand, because it will help you also understand why being a donor or becoming a donor will not affect your ability to have kids in the future, etc. So when you look at the ovary, and this is a picture of an ovary, you are born with a set number of eggs. Typically, a woman is born with about 1 million eggs, and by the time you reach puberty, you will have about 500,000 eggs to use up over your lifetime. Every month that you ovulate, 1 egg is released. However, in the few days, as soon as you get your periods, bunch of eggs, usually dozens of eggs, start growing, and then one of them becomes dominant, and that follicle releases the egg. All of the other eggs die. So every month, even though you released 1 egg, dozens and dozens of eggs are usually lost. We take advantage of this fact to help donors produce a bunch of eggs. So what happens is, when you come and see your doctor and you have an ultrasound, we can look at the ovary, and then this is an example of an ovary, where you can actually count the number of follicles that you have in your ovaries. This ovary, for instance, shows like roughly 10 or 12 follicles. A follicle is a fluid-filled sac that contains the egg. Now, you can't see the egg with the naked eye. If you take actually a sharp pencil and you make a dot on a paper, that's how big an egg is, the finest dot you can make. So you could theoretically see it if you have a good eyesight. I couldn't. But the eggs are contained in these little follicles that are filled with fluid that we actually can see on ultrasound, very easy. So when you go to your doctor, your IVF doctor, for your first visit, one of the most important tests you will undergo is this ultrasound exam for what we call an antral follicle count. These little follicles are called antral follicle counts. And the more of these you have, the better donor you are. Typically, a woman under the age of 30 will have 15 to 20 of these. There are some women who have 30, 40 of them. The younger you are, the more you have. And the more of these you have, the better donor you are, because the number of follicles contained in both of your ovaries will basically translate into the number of eggs you could produce if you took fertility hormones. So these follicles that you see in this ovary contain eggs, and this month, this particular month, all of these follicles that contain eggs will actually die off, and all the eggs are lost. Only one of them would become dominant and is released. So you lose dozens of eggs every month. So when we give you fertility hormones during an in vitro fertilization process, while you're going through the egg donation process, what we are trying to do is rescue or salvage some of those eggs that you otherwise would have lost that particular month. So you're not using up your eggs, which means you're not going to run out of eggs. This will not get you through menopause any sooner, and it doesn't affect your future ability to have kids. The eggs that we get from you that month, you would have lost them anyway. That's a very important concept to understand, and this is why donors can donate multiple times without ever affecting their ability to have babies themselves. So if you see this ovary and you can see these little black circles that are the follicles that contain the eggs, if this woman, this donor, took fertility hormones, which by the way are the same hormones your brain produces, if you took these hormones for about 2 weeks and you did ultrasound examinations, you will see that these follicles will actually grow. And here is an example of the same ovary, and these follicles are now ready and mature to be ready to be harvested. Now, if you didn't take fertility hormones, only one of those little follicles would become large, the size that you see here, and the rest would die off. So this is an example of a donor who took fertility hormones and is producing about 10 eggs on each side. So we could get 20, 25 eggs from a donor without affecting her ability to conceive later or or let's say affecting her reproductive health. Now, the process of getting these, the medications that you're taking are injectables. These are the same hormone your brain produces, and you have to take them on a daily basis for about 12 days. That's the average number of days a young woman will need to push her follicles to maturity. So during these 12 days of medications, which are injectable hormones, you will have usually 2 to 3 ultrasound examinations. Each one of them lasts 2 minutes, and we can basically count and measure these follicles. At one point in time, these follicles would be ready to be harvested. The eggs are mature. If we wait any longer, then the eggs will be old and will be useless. And if we go too soon, we get immature eggs. So the timing is critical, and an average donor will need about 9 to 11 days of medications before her eggs are ready. So now we go to the second half of the process, which is basically the procedure of egg retrieval. The egg retrieval is done under anesthesia. It takes about 10 minutes. There's no pain involved because you're put to sleep. You're not intubated, but it's like you're taking your wisdom tooth out. And then we go in through the vagina with a needle, and we can go into the follicles. And these black circles are the follicles. This is the needle, and we can look on the ultrasound while we're doing the procedure, and we can see the tip of the needle. You see these white dots here. That's the tip of the needle. That's very visible on ultrasound. And then we basically go into the follicle, and we aspirate or suck the egg that goes into the tube and then into what we call the IVF tubes contain certain media that's basically helpful for the eggs to grow. And we go one by one in each follicle and aspirate all of the eggs out. A typical donor would produce somewhere between 15 to 30 eggs. You are basically in our center for about 35-45 minutes to recover after the procedure, and then you walk home, and your basically job is done. Let's go to the next slide. Okay, let's see if it's not moving. Okay, these are the important facts that every donor should know before you sign up to do an egg donation process. As I mentioned, taking the fertility hormones will not make you run out of eggs. You're basically rescuing or salvaging eggs that otherwise you would have lost that month. There is no effect on your ovarian reserve or your future ability to conceive. You don't go through menopause any sooner, and these drugs are the same hormones your brain produces, except we give them to you in larger quantities. There are no real studies to prove an association between these drugs and ovarian cancer. So they are safe to take. Okay, so let's go to the next slide. As I said, when you meet your doctor for the first time, you have to do some tests. These tests are blood tests to check your ovaries. You do some tests to check for infections like HIV and hepatitis. You have a pelvic exam. We check for gonorrhea and chlamydia. You have a pap smear, and you have an ultrasound to check for the follicle count that we talked about, the antral follicle count. The typical medication protocol for a donor is you get your period, you call your doctor, you'll be placed on birth control pills for about 3 weeks. The purpose of the birth control pills is so that you get synchronized with the intended parent, and she actually goes on a birth control pill as well, or if there is a surrogate, the surrogate takes birth control pills. Once you both are on birth control pills, we can synchronize your cycles so you get your period at the same time. Then you will start taking fertility hormones, which are injections. We typically use 3 hormones called Gonal-f, Follicin, or Menopur. And then when the eggs or the follicles are ready, we give you one more injection called HCG, which we also call the trigger injection or the trigger shot. So the whole process takes usually 5 weeks, 3 weeks of which is taking birth control pills, then 2 weeks of fertility hormones, and then you undergo the procedure of egg retrieval to get the eggs out. And we'll talk a little bit about the risks and complications about this process. I'm going to go a little bit more in detail here to show you what happens. This is an egg with multiple sperm attached to it. So when we get the egg out, we incubate it with sperm in a petri dish to fertilize it. I think it's important for a donor to know what happens once your eggs are taken out. In some cases, we inject the sperm into the egg, and this is an egg here. And the sperm you can't see, but this is the sperm right there. It's injected into the egg. This process is called the fertilization process. It's done the day we take your eggs out. Then we grow the embryos for 3 to 5 days in a laboratory. And then we transfer the embryos into the intended mother with a little catheter procedure called embryo transfer. This obviously doesn't involve you. Your job is done once we get your eggs out. But I wanted you kind of to know what happens after the eggs are retrieved. The common side effects of the medications are stuff that happens in every woman's life every month. Headaches, some mood swings, bloating is common. There is a temporary weight gain because as you produce 20, 30 eggs, the eggs are in follicles filled with fluid. So your ovaries normally are the size of a walnut. They become the size of an orange. And certainly you will gain a couple of pounds that is lost 2 to 3 weeks later. Cramping is a very common side effect as the ovaries grow as well. Some rare complications are associated with the procedure of egg retrieval, where you're putting a needle into the ovary. Bleeding, which means we might have to put some pressure to stop the bleeding. It's almost unheard of to have to undergo surgery to stop bleeding. Theoretically, it can happen. Infections we almost never see because we give you antibiotics. There's a needle in your abdomen as we're getting the eggs out, so theoretically you could damage nearby organs. It doesn't happen because we do it under ultrasound guidance and you put to sleep so you don't move. It's very safe. Occasionally the ovaries can twist a few days after you have your procedure. I've been doing this for 23 years now. I've seen 2 cases of bleeding. I've seen 1 case of infection and 2 cases of ovarian torsion. And I've done probably 8,000 of these cases. So it just doesn't happen there. It's a very, very safe procedure. As far as questions, I don't know if anyone wants to ask questions, guys. I'm ready to take questions.
Thank you, Dr. Sahakian. Thank you. Just before I turn it back over to Gina-Marie, I wanted to let everyone know you can put questions in the question pane, and then after we wrap up within about 5 minutes, we'll try to get to all your questions. Just bear with us for a second. Okay, great. Gina-Marie, you want to take over?
Hi, everyone. Okay, so Circle Egg Donation provides compensation for our donors. Our donors are paid on an 8, 9, 10 pay scale, which means you get $8,000 for your first donation, $9,000 for your second donation, or $10,000 for 3 or more donations. Circle is approved by the American Society for Reproductive Medicine, and they give guidelines for donors' compensation. And those guidelines state that anything beyond $10,000 is inappropriate. So we do adhere to ASRM's guidelines. Now, why should you choose Circle Egg Donation? Circle Egg Donation is a full-service agency that has been matching intended parents and egg donors since 1995. Circle focuses on building a strong and appropriate relationship between the intended parents and donors and providing continual support through the process. So how should you apply? The first step, again, go to circleeggdonation.com and complete the application. If you have additional questions, you can direct them to Eleanor Sidman at esidman@circleeggdonation.com.
Great, thanks, Jean-Marie. So now we're going to take a few moments to answer some questions that we have. The first question is, can you provide, again, the name of the hormones and medications used within the process? Dr. Sahakian, can you answer that?
I don't see the question, and I couldn't hear you.
Sure. The question is, can you please provide, again, the name of the hormones that's used within the process?
Yes. Well, I don't know if we can go to my slide, but I can give them to you. Follistim is one of them that I use pretty much all the time, and the other one is called Menopur. Follistim is spelled F-O-L-L-I-S-T-I-M, and Menopur is M-E-N-O-P-U-R. There's another medication we use sometimes called Gonalef. So these are the 3 main medications in addition to the trigger shot, which is called HCG. Here we go. There's a Gonalef, Follistim, Menopur, and HCG, and of course a birth control pill.
Great. Thanks, Dr. Sahakian. We just have one more question. Is there a restriction to exercise during the process?
When you start taking injections, the fertility hormones, not when you're taking the birth control pills, but when you start taking the fertility hormones, and for a period of about 3 weeks, you cannot exercise or have sex.
Okay, so 3 weeks, okay. All right, wonderful. So if we have no more questions, we're going to wrap things up. Again, you can email Eleanor Sidman if you have any questions about the process or how to apply. We also do have a lot of information on our website. All right, thank you everyone for attending. We will be emailing you the recording of this webinar, this way you can review it again. And we hope that you apply with Circle Egg Donation. Thanks everyone. Thank you, Dr.
Thank you. Thank you. Bye-bye.
Bye-bye.